Good day everyone, my name is Kate Angel Di Baluyat and I am a nursing student at Pamantasan ng Lungsod ng Marikina, and today I will demonstrate Gordon's 11 functional health patterns. Gordon's functional health patterns provide a holistic model for assessment of the family because assessment data are classified under 11 headings. It also provides objective data that may indicate future decline or improvement in health status, allowing the nurse to plan and intervene appropriately. Before we start assessing the patient, we must first check his or her chart. Medical charts contain medically relevant events that have happened to a person. A good medical chart will paint a clear picture of the patient. Next is to wash hands and observe appropriate infection control procedures. Nurses washing their hands not only prevent them from getting sick, but it also reduces the risk of infecting others. If they don't wash their hands properly before coming into contact with others, they can infect their patients but also their family members. So, good day ma'am. I am Kate Angel Di Baluyat and I am a nurse practitioner student from Pamantasan ng Lungsod ng Marikina, and I will be completing your appointment for today. So, I'll just be asking you a few questions about why you're here and a little about your background or history. So, if you feel a little uncomfortable answering my questions, just let me know, okay? So, before we move on, can you please tell me your name and the date of your birth?
I'm Princess Carla Baluyet and I was born on June 5, 2000.
Okay, so we're just doing this to ensure that I'm with the right patient, and also you don't have to worry about the information you're going to share with me because it will remain confidential unless any healthcare personnel would want to access information for your care. Okay, so for the first set of health assessment, so this is for your health perception. This is to enable a more thorough report that clarifies about your patient, about your condition. Okay, so the first question is, how would you describe your usual health status?
I am healthy and active as of the moment, but I'm suffering from back pain.
Okay, so are you satisfied with your usual health status?
Actually, no, because I'm feeling back pain.
Okay, so do you use tobacco?
No.
Okay, how about alcohol? Do you
No.
drink? Okay, and recreational drugs?
None.
Okay, do you have any history of chronic illness?
No.
Okay. Do you take any immunizations?
No.
None. Okay, good. So, have you sought any healthcare assistance in the past year?
Last year, when I am required to get a medical before going to US for my OJT, the doctor and I found out that one of my lungs is unclear, wherein I also did a second opinion which helped me to take medications.
Okay, so I assume that you're studying, right?
Yes.
So, how would you rate your studying conditions?
It's not that stressful, but I'm doing great.
Okay, good. That's good. So, are you taking any medications?
None.
Okay, so how about your living condition at home?
My living condition at home is fine.
Okay, good. So, have you had any accident, injuries, or falls?
None.
Okay, so have you had any problems during the healing process if you have cuts?
None.
Okay, good. So, do you exercise on a regular basis?
Yes.
Okay, so what type and how frequent?
Just like light exercise only, and I usually exercise once a day.
Okay, so do you have any suggestions or requests for improving your health?
No.
Okay, so do you do breast self-examination?
Yes,
How often?
once a month.
Okay, so for the next set of questions, this is for your nutritional or metabolic. So this is to define your nutritional status and to define whether there are relevant malnutrition and to monitor changes in nutritional status. Okay, so do you have any weight gain or loss in the past 6 months?
Gain weight,
Okay, how many?
5 kilos.
Wow, that's great. So how about how would you describe your appetite?
I have good appetite, but I have a fast metabolism.
Okay, so that's explaining your okay. So do you have any food intolerance or restrictions?
None.
Okay, describe an average day's food intake for you, including your snacks.
5 times a day.
Oh, that's a lot. Describe an average day's fluid intake for you.
10 glasses a day.
Okay, so describe food likes and dislikes.
I like foods that are sweet and salty, but I don't like foods that are sour.
Oh, okay. Would you like to gain or lose weight?
Gain weight.
Okay, that's good. So, do you have any problems with nausea, vomiting, swallowing, chewing, or
None.
indigestion? Okay, none. That's good. So, would you describe your usual lifestyle?
Healthy and active.
Okay, that's good. So, for your elimination pattern, this is to ensure that you have a regular soft bowel movements and adequate urination and to identify different abnormalities. Okay, so what is your usual bowel movements? How frequent do you pee?
Every after meal, but usually if the climate is cold, 7 times a day.
Okay, so any history of constipation,
None.
diarrhea,
None.
incontinence?
None.
Okay, so that's good. So character of stool. So what is the color of your stool?
Brown.
Okay, that's healthy. So any bleeding?
None.
None. Okay. So for your usual voiding pattern, how frequent do you void?
Usually 2 times a day.
Are there full control of your void?
Yes.
Okay. So amount, what is the amount of your...
Normal amount.
So the color is brown and no incontinence. Okay. So for activity or exercise pattern, so this can improve your health and reduce the risk of having several diseases. Okay. So do you have any breathing problems?
None.
Do you have a cough?
None.
None. So how do you perceive your own self-care activities?
I really took good care of myself.
That's great. So, are there any changes in your heartbeat during exercise?
Yes, my heart beats faster when I'm doing exercise.
Okay, so do you feel pale during exercise?
No.
No, okay. What type of exercise do you have?
Light exercise.
Okay, so are there any problems?
No.
None, okay. How many pillows do you use to sleep on?
I have 5 pillows.
Oh, that's a lot, huh? Do you experience fatigue or weakness?
No.
None, okay. Do you have occupation or just
None.
studying?
I'm
Okay.
studying.
Describe your usual leisure time activities or hobbies.
I'm just playing volleyball, singing, and also doing TikTok dances.
Wow. So, any problems with concentration?
None.
None. Okay. So, for the next set of questions, is this for your sleep rest pattern? So, sleep is a vital and which is often neglected. So, this is a component of every person's overall health and well-being. So, what are your usual sleeping habits?
I usually watch live stream before sleep.
Okay. So that's make it easier for you to sleep. So, do you have any difficulty going to sleep?
No.
None. So, do you wake up in the middle of the night?
Yes. When I have to pee.
Okay. So, do you wake up early?
Yes.
Yes. Do you have insomnia?
None.
None. Okay. So, do you use any medication or warm fluid techniques to promote sleep?
No.
No. Okay. So, for your cognitive perceptual pattern, so this assessment is focused on the ability to comprehend and use information on the sensory functions. Okay. So, do you have any hearing difficulty?
None.
None. So, how's your vision?
I have a bad vision.
Oh, okay. So, when does your eyes last check?
Last December 2020.
And last change of glasses?
That month also.
Okay. So, any change in memory lately?
None.
None. Okay. So, important decision. Is it easy or difficult for you to make?
No, not really.
Okay. So, do you learn things easy?
Yes.
Okay. So, are there any discomfort, pain?
Yes, back pain.
Okay. So, what makes your back pain worse?
When I lie down for several hours.
Okay. So, what does the back pain feel like?
Stabbing.
Okay, stabbing pain. Okay, do you feel the back pain elsewhere?
No.
How would you rate your back pain in a scale of 0 to 10? With 0 being no problem at all and 10 being the severe.
7.
Okay, 7. So, when did the back pain started?
Last 2 days ago.
Okay, so is it constant?
Yes.
Yes. So, for your self-perception and self-concept pattern, this is to understand what attitudes or emotions you are experiencing internally. So, what is your major concern at the current time?
I think this pandemic.
Okay. So, how would you describe yourself? Most of the time, do you feel good or not good about yourself?
I'm feeling better.
Yes. So, is there any changes in your body or things you can't do?
No.
No. Is there any changes in the way you feel about yourself or body since you had illness?
No.
No, none. Okay. So, do you believe that you will have any problems dealing with your current health situation?
Again?
So, do you believe that you will have any problems dealing with your current health situation?
No.
Okay, so what are the things that frequently makes you angry or annoyed?
Whenever I have my menstrual period.
Okay, so fearful or anxious?
Whenever I have a decision to make.
Okay, so do you ever feel like losing hope?
Yes.
Yes. Okay. So on a scale of 0 to 5, rank your usual assertiveness level.
4.
Okay, so on a scale of 0 to 5, um, how would you rank your level of control?
5.
Okay, so for the next set of questions is all about your role or relationship pattern. So are you single, taken, or married?
I'm taken.
Wow. So do you live alone or with your family?
I'm living with my family.
Is it nuclear or extended?
Extended.
Okay, so any family problems you have difficulty handling?
None.
None, okay. So do you have any losses?
Yes.
Okay. So how do you handle this loss at this time?
I handle it by accepting the fact that he is gone and he already found real happiness.
Okay, so do you believe that this admission will result in any type of loss?
No.
So do you think that this admission will cause changes in family role?
Yes.
Okay, so how would you describe your social activities?
I am a jolly person, that's why I have a lot of friends.
Okay, so that's good. So how would you rate your comfort in social situations?
I am comfortable when I am close to the people around me.
Okay, so are things going well in your studies?
Yes.
Yes. So what activities or job do you like and dislike to do?
I like sport activities or adventure, but I don't like reading books.
Okay. So for your sexuality or reproductive pattern, so if you feel uncomfortable answering these questions, just let me know, okay? So how is your sexual life?
Good?
Are there any problems?
None.
Okay. Do you use contraceptives?
No.
No. Okay. When was your last menstrual period?
Today, I have a menstrual today.
Okay. So do you have any menstrual problems?
None.
Okay. So for your coping stress tolerance pattern, so is there any stressful or traumatic event happened recently?
None.
None. Okay. Is there anyone available to talk to you?
Yes.
Yes. So how would you rate your usual handling of stress?
I am handling my stress very well.
Okay, so that's good. So what is the primary way you deal with stress or problems?
By thinking of a certain decision many times.
Okay. So have you used any counseling groups in the past year?
No.
So when do you have big problems in your life? How do you handle them?
Usually family problems, and I'm handling it by understanding the both sides.
Okay, so most of the time, are these ways successful?
Yes.
So we are now in the last pattern, which is for your values or beliefs pattern. So are you satisfied with the way your life has been developing?
Yes.
Okay. So will this admission interfere with your plans for the future?
No.
Okay. So what are your plans for the future?
I want to be a flight attendant someday wherein I can give back to my parents.
That's great. So, what is your religion?
I'm a Roman Catholic.
Yeah. So does this help when difficulties arise?
Yes.
Okay. So are there any religious restrictions to
No.
care? Okay. So are there any other things we haven't talked about that you would like to mention?
None.
Okay. So do you have any questions?
None.
Clarifications?
None.
So that would be all. Thank you for your time to answering these questions, and I will forward this to the doctor and we'll see how we will proceed. So thank you. That's all.
Thank you.